Kwan implant restoration. The Kwan implant restoration concept involves placement of implants in their natural root positions and trajectories. After the appropriate numbers of implants were placed into their previous tooth or root positions, a corresponding scannable healing abutment is attached to the implant for proper healing and soft tissue profiling. With a non-contact intraoral 3-dimension scanner, an accurate virtual model can be generated on screen. Using any computer-aided design dental software, the final one-piece restoration implant can be created. An implant trajectory was chosen as the path of insertion for the dental prosthesis. All other implants would have a different trajectory to this insertion path. In order to create a common path of insertion for the dental prosthesis into all the implants, the obstruction of the abutment posts needs to be removed. Please note that only one side or 3 of the 6 surfaces of the abutment hex post is obstructing, never on both sides. During normal occlusion, lower teeth exert their forces on the cingulums and lingual cusps of the upper teeth. The labial side of the implants and abutments are resisting these biting forces. Please note there is no force acting on the lingual side of the hex. This clinically validated method provides a stable attachment of a one-piece implant prosthesis to multiple implants with different trajectories, without any intermediate components between the implants and the final restoration. The computer-aided design dental prosthesis can be fabricated directly from milling block of materials, including titanium, zirconia, and other tooth-like materials. After milling of the restoration, it can be aesthetically enhanced with customized porcelain. The final prosthesis can be directly inserted into the implants without any further steps. The prosthesis is stabilized by 2 set screws, as the forces from occlusion are directed to the apex superiorly and laterally, but not in the opposing direction. The Kwan implant restoration method allows the fabrication and insertion of a one-piece implant prosthesis in one single step after implantation. Kwan implant restoration.